Everyone, once again welcome to my Oet channel. So today we will see another one role play card in which the scenario is happening in emergency department, and we are talking to a person who had a fall yesterday evening when running to catch a bus, and he is concerned that he has some health issues related to fall. Maybe it's like a fracture or something, and we are getting some information from the patient, and the scenario is going until the patient's consultation with the doctor. So let us start. So just I will read you the settings. Your patient is 45 years old and hurt himself in his hip in a fall yesterday evening when running to catch a bus. His hip is very bruised and the pain has got worse overnight. And he has come to the emergency department because he is concerned that the hip is broken. So just assume that you are the emergency department nurse and you are approaching the patient to ask patient's concern. So the first task is find out reason for patient's visit to emergency department. So this is it is like a common scenario. So we can just start with introduction, self-introduction. And this is a morning scenario. So good morning, my name is Rishmi Rajan, one of the registered nurses working in this emergency department. How may I address you and how can I help you today? Then, from patient side, he may tell you, my name is George and sister, I came here for getting some medical advice for my injured hip. Then, the answer should be in a sympathetic manner. Oh, Mr. George, I am so sorry to know about your condition, but no need to worry, I am here to help you. Then the second task is find out more details about patient's fall or injury, any bleeding, bruising, ability to walk, weight bear, severity of pain, effect of any pain relief taken. So we can ask. Before proceeding further, Mr. George, may I ask you some questions regarding your injury? Is it okay for you? Patient is telling us, okay, you can ask me. Then we can ask in this way. Is there any bleeding or any bruising area over your body following the fall? The patient is telling that actually there is bruising area over my hip region, but there is no active bleeding. Then we can ask the ability to whether you can able to walk or weight bear, or is there any difficulty if you are if you are taking any weight over the area. Then patient is telling that, yes sister, actually this area it is I'm getting so much pain and I could not bear any weight. That means I could not even walk normally. Then we can tell that, okay Mr. George, I can truly understand your condition. For my better understanding, could you please rate your pain in a scale of 0 to 10, where 0 is no pain and 10 is the worst pain. Then patient is telling that I can tell you that it is 8 out of 10. Then we can tell that, oh, I can understand that you have severe pain, isn't it? No need to worry. And the last question I want to ask you that whether have you taken any pain relieving medication at home? The patient is telling that yes, I took paracetamol tablet for my pain relief. Then we can tell that, okay, thank you for your information, and I would like to find out any other injuries from fall, whether you have any cuts or any head trauma or anything, are you getting headache or anything after the fall. Then patient is telling that no, actually I have only the problem in my hip area, other than that everything is fine. And then we can tell that, okay, thank you for your all informations. Then the next task is find out further relevant patient details regarding the health conditions, long-term medication, if diabetic or smoker, previous joint or hip injuries, etc. Then we can ask for getting furthermore your history. May I ask you the question regarding your health condition? Do you have any medical condition or surgical conditions, or are you on any long-term medications? Patient is telling that no, I don't have any condition and I'm not on any medications. Then I can tell that, oh, it's fine to hear that you are perfectly all right in your general condition. And are you a smoker? Then patient is telling that, oh, I doesn't smoke. Then we can ask that, and the last question is whether you had any joint or hip injuries before. Patient is telling that no, nothing has happened before, same like this. Okay. Then the next step is explain the next steps like vital sign assessment, return to waiting area until doctor available, examination by doctor, provision of pain relief, decision on treatment, etc. Then we can tell that, well, Mr. George, I got your point, and I have noted everything for your doctor's consultation. And the next step is we are going to do your vital signs, and you can return back to the waiting area until your doctor will be available, because right now the physician is very much busy in examination room with another one patient. But no need to worry, I will let him know about your condition, and he will visit you without any delay. And after doctor's consultation, doctor will prescribe you the pain relief medications, and I can administer for you. And thereafter, doctor will discuss about your further treatment. How does that sound? Because we are giving more explanations. Then patient is telling that, okay, sister, it's okay, fine, but I think I have to wait for a long time for the doctor. So if you don't mind, could you please tell me what is my diagnosis? Then the next task is resist request for diagnosis, because it's not your role and only available after doctor's examination. X-ray only ordered by doctor. Then we can tell that, Mr. George, I can truly understand your concerns, but I am sorry to tell you that I am not the right person to tell you the diagnosis, and it's only available after doctor's examination, and only doctor have the authority to order for an X-ray. After X-ray only we can confirm that whether you have fracture or any other problems. So I'm reassuring you that it will not take long time. I can just wait here for 5 to 10 minutes. By that time I will get your doctor, so that we can continue with all these steps. Is it okay for you? Then patient is telling that, okay, it's okay, fine, I can wait. Then the last task is establish patient's consent for assessment of vital sign. This is nothing but just verbally we are getting the consent, not with the paper. Okay, so we can ask that. If you, I hope, Mr. George, I hope I have clarified all your doubts. If you don't have any other clarifications, may I proceed with your vital signs assessment? Then patient is telling, yes, of course you can do that. Thank you. That's only the role play. So here, this is just we are just explaining the further management, and here actually you are getting more information from the patient, and you are just telling about the further treatment modalities. That is only the content, and this is mostly the first role play. You will get enough time. Actually the second role play only you will not get enough time. You have to be somewhat fast enough in the second role play task. So I hope it is clear for you. And one thing you have to concentrate here, establish patient's consent for assessment of vital signs. There, don't tell that, can you just sign the consent form? It is not consent form. Just you are getting verbal consent. That means I hope I have clarified all your doubts. If you don't have any other doubts, may I proceed with the procedure? That's all. Okay, just patient. We need the answer that is you can proceed. That is only the thing. So I hope it's clear for you. You can just practice yourself in this way. I hope it will be very easy for you if you are following in this way. So we will meet you with another one role play. Until then, bye. Take care.